Hello, this is Dr. David Green, CEO of the Mid-Atlantic Pain Network. Today's topic is how to avoid surgery for degenerative disc disease. When looking at the normal intervertebral disc, you have a harder outer layer and a gelatinous inner layer. A lot of people analogize it to a jelly donut. The outer layer does have some nerve endings. You can feel pain from tears here. The inner layer has no nerve endings at all. No pain is generated from the inner region. It serves as an excellent shock absorber as we walk, run, twist, bend. Water gets pushed out of the disc. It is 80% water, and then it gets pulled back in, so it really does a great job of absorbing shock. As we age, or due to any number of factors, a person loses disc water, and that can lead to degenerative disc disease with height loss. Pain may occur from the resulting tears and cracks in the outer layer of the disc, known as the annulus. 40% of the time, the intervertebral disc is the cause of low back pain. It may lead to inflammation and irritation of the adjacent nerve roots and can cause sciatica, even if you don't have a herniated disc. It may lead to daily disabling pain, or it can be completely asymptomatic. There's been studies looking at this of imaging MRIs of people who have no back pain at all. 35% of those between the ages of 20 and 50 have degenerative disc disease and have no pain whatsoever. Treatment options for degenerative disc disease, first and foremost, will be over-the-counter medications such as anti-inflammatories and Tylenol. Narcotics can be helpful for short-term exacerbations, topical pain creams or patches, muscle relaxers for short-term exacerbations. Physical therapy can be very helpful. Chiropractic treatment along with TENS units, spinal decompression therapy such as you see here, which involves intermittent computerized spinal traction. Acupuncture can also be very helpful. When you start looking at interventional treatment options, you have trigger point injections, which are superficial injections, which are great for relieving aches and muscle spasms. Intradiscal injections, such as you see here. There's been studies looking at steroid injections. Obviously, that doesn't fix degenerative disc disease, but it can provide excellent pain relief for a few months. There are now intradiscal injections with stem cell therapy, such as bone marrow-derived stem cell therapy. Those are showing excellent promise. There's been some poster presentations at various pain meetings showing great outcomes in small amounts of patients, like 20, 25 patients. Facet treatments, those are the spine joints that are in the back of the spine, such as medial branch block injections, facet injections, and then possibly a radiofrequency ablation. People might say, well, that's not the actual disc, that's the joints behind the disc. Yeah, but most of the time if you have a degenerative disc disease, you're screwing up the biomechanics of the back, and you're getting arthritis and pain in those spinal joints. Epidural injections can be helpful if the nerve roots are being irritated, even if you don't have a disc herniation pushing directly on a nerve. You can get irritation of those nerves just from having the torn disc, causing inflammation in the area. IDET is not really performed much anymore. Intradiscal electrothermal treatment. There was some initial excitement about it, but because it didn't really pan out, insurance companies stopped covering it. Mild is minimally invasive lumbar discectomy. That is still performed somewhat because it can take pressure out of the nerve, out of the disc, and relieve pain that way, but it's falling out of favor as well. Radiofrequency ablation, as you can see here, involves heating up these little nerve endings that supply sensation to these joints, and that can relieve back pain for 12, 18 months at a time. So here's a couple pictures of stem cells. Basically what you do is you harvest bone marrow from a person's hip. It gets put into a bag, which then gets processed and concentrate the stem cells as well as the growth factors, and then you can inject it into a person's degenerative disc. Initial studies are showing great results because not only are you relieving pain, you're also helping to regenerate and repair the damage. Comparison of long-term outcome for patients with back pain and who had a positive discogram did not demonstrate a significant difference in outcome measures of pain, function, disability based on whether the person had surgery or not. Surgery is not always a great answer for degenerative disc disease. Over 3/4 of the time, patients are able to achieve a satisfactory level of baseline pain with the pain management treatments mentioned and avoid surgery. The top non-operative pain management in the Mid-Atlantic region is through the Mid-Atlantic Pain Network. There are many clinics throughout the area as part of the network, accepting over 50 insurances and providing over 25 treatment options with the board-certified, award-winning doctors. Visit us online at midatlanticpainnetwork.com and then call us for more information and scheduling at 855-444-6585. I'm Dr. David Green with the Mid-Atlantic Pain Network. Your pain stops here.